So, tell me about your rehab so far. I know it's been a couple weeks since we last chatted, but tell me about how that experience was because you were back in rehab,
Day
and
this
how did those sessions go?
Oh, my range is got, you can't, I've got this on, but they've got this on, this shoulder opened up a lot. She's been working a lot on these tendons in my hand. No one before this therapist had ever, they just had me, kept doing this, although they had the shoulder, but no one worked on my lower hand. I said, well, how am I going to get any relief there if they don't do it? So I said, what I'm trying to do, just basically because of financial, I'm going with you guys 100%. And she said, do a lot of wall climbs to keep this range going. It's about to 135, Nick.
Oh, that's really good, Deb, actually. So you're getting up to basically like 135, something like this?
Assisted.
Sure, sure.
That I can share with you because they did an evaluation last week that I could get for you because
Okay.
they did all this. But assisted, I can get 135 and it not hurt and not be so painful. So
That's beautiful, Deb.
yeah, yeah. And they don't feel like I've plateaued out at all. They said they always see progress, and she's giving me exercise. She is super excited about this.
That's awesome, Deb. I think one of those things I was going to ask you about was, are you able to do, like, if you're to do the wall climbs, how far can you get up your arm if you walk up?
Without my arm,
Yeah.
maybe 3 inches on my own, Nick. But with this,
Okay.
maybe about halfway up.
Okay. Okay. Well, I guess what I'm asking, Deb, is if you were to, because one of the things you mentioned is trying to make sure you keep that shoulder mobility going, right?
Right.
One thing you can do is you can take your right arm and you can use the wall and you can kind of go up with your left arm. And once you get past like 90 degrees, you can then continue to lean into it and try to maybe walk up a little bit. And that would be one way that you can kind of get assisted. You can assist yourself to keep that range of motion in your shoulder.
Sit like you did. Should I sit like that or should I stand? Because the balance is good, but it's kind of scary. You know what I'm saying?
Exactly. So I think actually, if you can do it seated, now I don't know your new place, but if you have a place where you can do it in your house, I would say honestly a really good option for some people. If you have to do it seated, do it in a door jamb. Find an open door, sit in the middle of the door, right? And what you can do is you can put the chair very, very close. If you imagine the door frame is here, you put the chair very close to the edge of the door, that sort of threshold of the door. And what you do is you actually will just scoot your body forward. So you don't have to scoot the chair forward, but you scoot your body forward as you go up and up and up and up. Alternatively, if you have like a roller chair, like I'm in right now, I can twist around. You can use a roller chair. That might be helpful too. If you find that you're in a wheelchair, I think that's another option too for individuals out there who are trying to get some shoulder mobility. That can be a really good way to do that as well. Use your less affected limb to kind of get you past the 90 degrees and then lean in with your body up to the point where you're getting some of that range.
That's good. Now, it's a dumb question. Am I actually putting the hand in the jam, or am I having the door closed and then doing the exercise on the door, or am I doing it on the jam?
On the molding around the door. So we would want the door to be open because ultimately, imagine, right, if the door is here, well, I guess if the door is, it's kind of hard for me to see. If the door is here and I'm walking into the door like this, you would have to have your arm pretty far. If you want to get pretty far up, you're gonna have to be basically inside the door. So it needs to be pretty close to the door. So maybe what I can do, Deb, I can have a friend of mine here, a colleague at Motus, take a video of me explaining this, and I can just send that to you. That way you can kind of see what's going on.
Someone else can use it too. So cool.
Exactly. Yep. As always, Deb, you inspire such great ideas. So